Rural areas in the United States consist of approximately 97% of our nation's landmass. An estimated 60 million people, or 1 in 5 residents, live in rural America.
Healthcare in rural America has always been challenged by limited resources to allow a sophisticated level of care to be attained, by challenges to recruiting and retaining personnel, especially as America has evolved to a more urban-based country, and by the travel distance it takes for patients to get to healthcare facilities.
In the late 1800s, Dr. Mary Imogene Bassett and her mother, Dr. Mary Augusta Bassett, had a different vision. It was a vision that revolved around creating healthy, rural communities. In 1869, the Bassett women moved their growing medical practice to Cooperstown, New York, where they practiced in a house that still stands today. As physicians, the Bassett women were not only pioneers in medicine, but they were also pioneers in the creation of comprehensive rural medical care. Among Mary Imogene's friends and patients was American philanthropist Edward Severin Clark. He had tremendous admiration for Dr. Bassett, and when he heard her express a wish for a laboratory to provide scientific data with which she and the other Cooperstown practitioners could better care for their rural patients, he honored her wish. But he not only built a laboratory, he built a fully equipped 100-bed hospital that he named the Mary Imogene Bassett Hospital. By today's standards, a lab is a common tool that every doctor has access to. But for Dr. Bassett, in the early 1900s, to envision a lab where multiple doctors could share research was extraordinary for the time. She truly was visionary. Tragically, in 1922, shortly after the hospital opened, Dr. Bassett died of a stroke. Mr. Clark directed that the light in the cupola be lit every night in her memory. Soon after Dr. Bassett's death, the hospital began struggling to keep its doors open and eventually closed. Not long after the hospital closed, senior residents at the Presbyterian Hospital in New York City were discussing their hopes to work in a rural hospital. A junior resident, Dr. Henry S.F. Cooper, overheard their conversation and mentioned that he knew of a vacant, state-of-the-art 100-bed hospital in Cooperstown, New York. Dr. Cooper was a descendant of Judge William Cooper, who had founded the village of Cooperstown in 1787. So, in August 1925, Dr. Cooper and 3 interns flew to Cooperstown in a loaning seaplane and landed on Lake Otsego. The team of interns were thrilled to find this beautiful hospital with the latest state-of-the-art equipment. In March 1927, the hospital reopened, and soon after, Dr. George Minor Mackenzie became both director and physician-in-chief. Dr. Mackenzie envisioned an ideal rural hospital dedicated to patient care, education, and research, where the practicing physicians were full-time and salaried. His guiding philosophy was to create the strengths of a university hospital in a rural region. In 1947, just before his retirement, Dr. Mackenzie established a formal link between Columbia University's College of Physicians and Surgeons in New York City and the Mary Imogene Bassett Hospital in Cooperstown, New York. This created a teaching hospital in a rural setting, something virtually unheard of in the United States. That partnership, inspired by Mary Imogene Bassett's dedication to creating healthy rural communities, thrives at Bassett Health today. Providing access to medical care for children by supplying doctors and dentists to elementary schools. Creating safer work environments with the farm, forestry, and fishermen safety initiatives. Providing elder care for the pioneers in each of our families. Making emergency services accessible in those critical moments when time means everything. supplying cutting-edge technology to our physicians and specialists in their everyday battle to save lives. And simplifying the new frontier of telehealth by providing access to convenient, affordable, and reliable expert medical attention for the diagnosis of common illnesses, consultations about new symptoms, chronic disease management, triage for injuries or acute illness symptoms, and mental health therapy. With over 90 locations serving Central New York, Bassett Health continues to provide access to convenient, affordable, and reliable expert medical care to nearly 1 million rural patients spread across 5,800 square miles, the geographic size of Connecticut. Through advanced integrated clinical services, education, and research, Bassett aspires to be a model of excellence for health, creating remarkable patient experiences and better living. Over 100 years later, Dr. Bassett's determination and conviction lives on in each and every Bassett caregiver and practitioner in their relentless pursuit of her vision, creating healthy rural communities, striving to provide the best health care without losing that personal connection, fostering a more excellent way.